Silence. And please close the door. That one also. So, last lecture, what was it? What was the topic? Parkinsonism. So, what was it? Remember anything? Right. Very good. What else? What else you know? Any symptoms you remember? One by one, I'll ask you. Close the door. So, what symptoms? Yes, you. Second row. Right, tremors. What else? What type of tremors? Tremors can be intention tremor, tremors can be resting tremors, wheel rolling tremor. Resting or intention? Close the door. Resting or intention? Intention. What is the difference? Just last row. You. White t-shirt. The last row. क्या पूछा मैंने? उसके बाद किसमें? हाँ? कौन से ट्रेमर्स? प्लीज डोंट. कौन से ट्रेमर्स? बैठ जाओ. Resting and intention tremors. As the name indicates, resting and intention. Resting means it's always present. Intention means when you're doing something, then the tremors are there. ठीक है? So tremors in Parkinsonism are resting tremors. Even if you're not doing anything, it's already there. That is resting tremors. An example of intention tremor? Intention tremor, essential tremor. When you're doing anything, then the tremors are there. When you're trying to hold a glass of water, then the tremors are there. Alzheimer's can be there. And essential tremor is usually withdrawal tremors. It also has a genetic basis. It has, cerebral disorders. It also has a genetic basis usually. Also due to alcohol withdrawal. Tremors are intention tremors. Fine. So topic is different today. I just wanted to brief a little. Topic is neurodegenerative diseases. Neurodegenerative. The degeneration of the neurons in the brain. Degeneration क्यों होता है? We all age. After a while, there is degeneration. It can be due to aging, it can be due to multiple toxins, or it can be due to autoimmune disorders. So all these causes degeneration of the neurons in the long run. Fine. So basically we'll deal with the Alzheimer's today, and there are a few other disorders that we should know. Parkinsonism, we're already done with it. Alzheimer's, then Huntington's chorea. It is degeneration of the GABAergic neurons in the nigrostriatal system. As we all know, the GABAergic neurons are inhibitory. So, there will be excitation, chorea. First of all, Huntington's chorea, it is a genetic disorder, and due to multiple CAG repeats in the genes. And as the name indicates, chorea is an involuntary movement, involuntary contraction of a group of muscles. So it is a genetic disorder with involuntary movements, excitatory because GABAergic neurons are inhibitory, and due to degeneration of the GABAergic neurons, we can have Huntington's chorea. Amyotrophic lateral sclerosis, degeneration of the spinal, bulbar and cortical neurons. And multiple sclerosis. Multiple sclerosis is a autoimmune disorder because हमारी बॉडी को लगता है कि हमारे न्यूरॉन्स are a foreign body, and the antibodies produced by the body attacks those neurons and causes demyelination of the neurons. ठीक है? First of all, we'll start with the Alzheimer's disease. Alzheimer's disease. किसी ने पेशेंट देखा है अल्जाइमर का? हाँ? Speak a bit louder. कौन सी मूवी में? उरी में? अच्छा, उरी में. और मूवी के अलावा we had a politician who is no more. He was a patient of Alzheimer's disease. Anyone remember? Atal Bihari Vajpayee. He had Alzheimer's disease and he died due to it. So what happens? We have our neurons in the brain which are involved in memory, cognition, and coordination of the activities. So with age or with some neurological insults, those neurons got damaged. How? Any risk factors? First is old age, as I have told you. After 65 years of age, there is more chances of having Alzheimer's disease. तो एक तो हो गया degeneration, normal degeneration, जो एज रिलेटेड है. दूसरा जेनेटिक हो गया, ठीक है. और क्या हो सकता है? एक्सीडेंट से अल्जाइमर यूजुअली नहीं होता, क्रोनिक इंसल्ट से होता है. क्रोनिक इंसल्ट, एक्सीडेंट इज एन एक्यूट कंडीशन. क्रोनिक इंसल्ट कैन बी वैस्कुलर इंसल्ट. क्रोनिक अगर ब्लड सर्कुलेशन कॉम्प्रोमाइज हो रहा है, कहीं पे इन्फार्क्ट्स हो रहे हैं लॉन्ग टर्म में, दे कैन बी लैकुनर इन्फार्क्ट्स इन द ब्रेन. इन द लॉन्ग टर्म it may also cause Alzheimer's disease because of the damage. तो अगर इन्फार्क्ट हो रहे हैं तो रिस्क फैक्टर्स क्या हो सकते हैं? इंक्रीज इन द कोलेस्ट्रॉल, दैट कुड बी रिस्क फैक्टर. स्मोकिंग इज अ रिस्क फैक्टर. इंक्रीज अल्कोहल कंजम्पशन, दैट कुड बी रिस्क फैक्टर. ठीक है, these could be the risk factors. Earliest symptom is short-term memory loss. Short-term memory loss. What does it mean? Short-term, long-term memory loss. क्या? Gajini, right? Short-term memory loss. Long-term is long-term memories. You went to Thailand 2 years back. Anywhere, you would have gone 4 years back. So that is long-term memory. You'll keep on remembering that. But Alzheimer patient में सीधे नहीं हो जाएगा. You won't remember कि he went there anywhere. So that is long-term memory. Short-term memory is memory of recent events. Like, he had pasta last night. He won't remember it. He took bath or not, he won't remember it. That is short-term memory. So, starting with the short-term memory. But, he'll remember the past. कल क्या हुआ था, परसों क्या हुआ था, वो भूल गया. तो कोई आदमी वैसे ही भूल जाता है, कई लोग भूल जाते हैं. विदेश आज मैं पढ़ाऊंगा, कल आप लोग भूल जाएंगे. So, will that be Alzheimer? Then that won't be Alzheimer. Actually, we need continuous practice. Whatever we learn, we need continuous practice to make the neuronal pathway permanent. So आज कुछ पढ़ा है तो ठीक है, 2 दिन बाद भूलोगे. That is fine. But आपको ये भी याद ना रहे कि आपने कुछ पढ़ा था कल. That is Alzheimer. ठीक है, क्या पढ़ा था वो भूल सकते हो, पर पढ़ा भी था, ऐसा कोई इवेंट भी हुआ था, forgetting that is Alzheimer. ठीक है. So, progressive disablement, starting with the memory loss, then पहले मेमोरी लॉस हो गया. मेमोरी लॉस होगा तो क्या होगा? बिहेवियरल चेंजेस होंगे. यू वोंट रिमेंबर. आप बोलोगे कल ऐसा हुआ था, यू वोंट रिमेंबर. बोले तुम्हें ये भी याद नहीं है, तो पेशेंट मे बी एग्रेसिव आफ्टर अ व्हाइल. ठीक है, दैट कुड बी देयर. देन एज द डिजीज प्रोग्रेसेस, सिम्टम्स विल प्रोग्रेस. There is a movie of Kajol. There is a movie also, na? I don't remember the name. Kajol was having Alzheimer. Black नहीं थी. It was some other movie. She was having Alzheimer. So, at the end stage, you can even forget your home. You cannot even come back to your home. You went out. Please don't talk. You go out to buy vegetables and then you're a vegetable. You don't know how to come back. Okay? So how we detect it? Progressive atrophy of the brain. So ventricles will increase in size. Ventricles will increase in size. वेंट्रिकल्स में क्या होता है? CSF होता है. तो ब्रेन छोटा होगा तो CSF ज्यादा लगेगा आपको, होगा तो उतना ही. बट देयर विल बी एट्रोफी. तो एट्रोफी ब्रेन की होगी तो द वेंट्रिकल्स विल इंक्रीज इन साइज. सो इफ विल गो फॉर द CT ऑफ द पेशेंट, देन वी कैन इजीली डिटेक्ट इट. और MRI में क्या दिखेगा? एट्रोफी ऑफ द गैर आयन सेल का. ठीक है, ग्रे मैटर, व्हाइट मैटर, गैर आयन सेल का जो होते हैं वो कम हो जाएंगे. Risk factors, as I told you: age, hypertension also causes infarcts in the long run. Cholesterol, I've told you. Coronary artery disease. Diabetes. Diabetes is the causative of most of the infarcts because it causes increased atherosclerosis of the vessels. Then Down syndrome. In Down syndrome also there is chances of development of Alzheimer's disease in the long run. Degeneration of the neurons कहाँ कहाँ पे होते हैं? Mainly temporal lobe, parietal lobe and frontal lobe. ठीक है? Frontal lobe में भी have areas, Broca's होता है, वर्निक्स होता है फ्रंटल लोब में. टेम्पोरल लोब में कौन सा होता है? The two centers ना एनाटॉमी में पढ़े हैं ना, वर्निक्स एंड ब्रोकास. वर्निक्स इज फॉर वर्निक्स इज इन टेम्पोरल, राइट. वर्निक्स इज इन टेम्पोरल लोब and Broca's is in frontal lobe. तो क्या होगा? वर्निक्स अगर इन्वॉल्व हुआ तो एफेक्शन खत्म हो जाएगा. एफेक्शन मतलब पेशेंट विल कीप ऑन टॉकिंग बट इररिलेवेंट. एंड Broca's इफेक्ट होगा तो देयर विल बी डिसआर्थरिया. यू विल नॉट बी एबल टू स्पीक because motor component effect होगा of the speech. Frontal lobe की वजह से behavioral changes भी होंगे. Frontal lobe is involved in maintaining the behavior. तो behavioral changes होंगे patient में. Frontal lobe is also involved in olfaction. So anosmia हो सकता है, personality changes हो सकते हैं. Temporal lobe, frontal lobe की वजह से speech disorder हो सकता है in the long run. There are two things in the pathology. One is A beta amyloid and the other is neurofibrillary tangles. A beta amyloid is formed from amyloid precursor protein. There is an enzyme called gamma secretase which forms A beta amyloid from the amyloid precursor protein. So if that enzyme is overactive, then there will be more production of A beta amyloid and it causes the deposition of amyloid plaques outside the neurons. Neurons के आसपास plaques deposit हो जाएंगे, amyloid plaques deposit हो जाएंगे and in the long run they causes damage to the neurons because of the pressure effect. ठीक है? दूसरे होते हैं neurofibrillary tangles. They are made up of tau proteins. They are made up of tau proteins, and when this protein is hyperphosphorylated, then it is deposited in the neurons, inside the neurons, and causes axonal damage. ठीक है? न्यूरॉन्स डैमेज करेंगे अंदर से, neurofibrillary tangles. और amyloid precursor protein outside the neurons and causes damage by pressure effect, जिसकी वजह से सेल डेथ होगी, न्यूरनल डेथ होगी, न्यूरनल एपोप्टोसिस होगी और न्यूरॉन से जो भी न्यूरोट्रांसमीटर्स बनते हैं they will get affected, like acetylcholine, noradrenaline, serotonin. ये सब बनना कम हो जाएंगे. And cholinergic system is mainly responsible for the memory. So cognitive decline and memory loss in the patient with Alzheimer's disease. Symptoms: basically, we can diagnose the patient with symptoms. Tests are advised later on. Main symptoms: mild memory loss, starting with the memory loss, short-term memory loss. Language problems, behavioral changes, personality changes, as I've told you, because frontal lobe is involved, and diminished judgment, moderate में, unable to learn or recall, unable to learn new things, and the recall is affected. Long-term memory is also affected. We started with the short-term memory. In the moderate disease, long-term memory is also affected. Patient is aggressive, wandering, कहीं भी चला गया, आया नहीं आया, wandering, बीच में याद आ गया उसको तो आ गया. And severe disease. Patient will not be able to do his daily activities. Not able to take bath, not able to button or unbutton his clothes, gait disturbances, urinary incontinence can be there, bedridden, and placement in long-term care is needed, or we need a good caretaker for him or her to take care of his daily activities, basic necessities. So as I have told you about the pathway, मैंने बताया था ना अभी, amyloid precursor protein forms A beta amyloid, which is an insoluble form and gets deposited in the plaques, and these plaques damage the neurons. So पहली बात तो ये है कि it is irreversible. Alzheimer's is irreversible. We don't have a permanent therapy for it. We can slow down, and we can give a better life, if not good, to the patient till he or she survives. So ultimately he has to die, but we can increase the life of the patient. So these plaques deposited, these plaques cause a pressure effect, oxidation, inflammation, aggregation. So what else can be given? Antioxidant can be given, and PPRA gamma agonist. क्या होते हैं? पढ़ा हुआ है सबने? डायबिटीज हो गया आपका? नहीं हुआ अभी? ठीक है. PPRA gamma agonists are given in the diabetes, pioglitazone, all the glitazones. They can also be given because they are also having antioxidant effect. NMDA antagonist like memantine, that can be given. NSAIDs, as we all know, NSAIDs are anti-inflammatory because cytokines causes inflammation. So NSAIDs can be given. Estrogens. It is also a disease of post-menopausal women because of decreased estrogen. So we don't know anything. These all things are that we can supplement. There are multiple theories, and those neurons which are damaged, that cannot be reversed. We can just give the patient a good lifestyle. So whatever we have, we can use them. So estrogens can be given. Then A beta aggregation हो रहा है. A beta amyloid के प्लेक्स हैं. ये सारे प्लेक्स जो हैं ये एग्रीगेट हो रहे हैं, डैमेज कर रहे हैं. तो heavy metals are also involved in it, in the plaques. So we give heavy metal chelators like desferrioxamine, that can be given. Tau protein hyperphosphorylation forms neurofibrillary tangles. Ultimately, what happens? Death of the cholinergic neurons, death of the serotonergic and adrenergic neurons, and these neurotransmitters get depleted. तो हम यूज क्या करते हैं? ये तो बहुत कुछ हो गया. What we use is acetylcholinesterase inhibitors. These are the drugs which are mostly used. We can supplement them with other drugs, but these are the drugs that are to be used because we have to increase the acetylcholine, and acetylcholinesterase inhibitors can decrease the degeneration of the acetylcholine and increase the neuronal acetylcholine. We can also give nicotinic agonist, 5-HT6 antagonist. These all can be given. So, approved drugs, cholinesterase inhibitors, donepezil, rivastigmine, galantamine. These are cholinesterase inhibitors that are to be given, that have to be added. उसके अलावा we can add memantine along with them. Nicotinic receptor agonist. This is an experimental drug under trial still. 4-OH-GTS21. That is under trial. Antioxidants like ginkgo, biloba, vitamin E, melatonin, ये सब. PPRA gamma agonist, pioglitazone used in diabetes. Ginkgo biloba खाया किसी ने? खाया? नहीं खाया? रिवाइटल खाइए किसी ने? उसमें होता है. It's all experimental. It's all experimental. No use as such. Vitamin E, it is an antioxidant, so can be given. Melatonin, melatonin gives you good sleep, can be added. Gamma secretase inhibitors. It is Simagestat. Gamma secretase क्या कर रहा है? Increase the production of A beta amyloid. So gamma secretase inhibitors decrease the production of A beta amyloid. So prevent the disease progression. Hypothetically. Otherwise, everything will happen. Statins, simvastatin, pravastatin, because they can prevent the future infarcts. You all know about it. Acetylcholinesterase inhibitors, how they work. They inhibit the enzyme acetylcholinesterase, increase the neuronal acetylcholine, stimulate the nicotinic and muscarinic receptors. 4 drugs which are commonly used are tacrine, donepezil, rivastigmine, and galantamine. Tacrine is not used because of hepatotoxicity, so not used. And cholinergic adverse effect, or chances of cholinergic adverse effect are very high. वो क्या होता है? cholinergic adverse effect क्या होता है? cholinergic adverse effect ड्राई माउथ होता है. क्या होता है? ANS पढ़ा है आप लोगों ने सारा. cholinergic adverse effect क्या होगा? Lacrimation, right? Increase in secretion. वो anticholinergic हो गया. Cholinergic effects are increase in all the secretion, salivation, lacrimation, सब बढ़ जाएगा. Diarrhea, urination, acidity, right? So those side effects are very high with tacrine, so not used. Donepezil is used. It has got a long half-life also of around 70 hours and not hepatotoxic. 5 milligram per day dose से start करते हैं and increase it to 10 to 15 milligram at the most per day. Reverse TIG mean plasma half-life of 2 hours. Start with the 1.5 milligram BD dose and then can be increased to 3 milligram BD. Reverse TIG mean का transdermal patch भी available है in the market. So it can have a smooth plasma level and sustain for the long run. Galantamine, it is also very potent drug, 50 times more selectivity for the human acetylcholinesterase, dose is 4 mg BD. ADR, वही जो cholinergic side effects होते हैं, bronchoconstriction, diarrhea, increased secretions, bradycardia can be there. NMDA receptor antagonist, memantine. NMDA क्या करता है? It increases the excitation and apoptosis of the neurons. So, NMDA antagonist prevent the cell death and apoptosis, like memantine. That can be given. Dose, maximum dose is 20 milligram. 5 milligram per week से start करता है and could increase it to 5 milligram every week if there is no effect. Experimental therapies, nicotinic receptor agonist, ठीक है, एंटीकोलिनेस्टर्स हो गया. एंटीकोलिनेस्टर्स क्या हुआ? मस्करीनिक निकोटिनिक एगोनिस्ट हो गया ना. एसिटाइलकोलिन बढ़ जाएगा तो मस्करीनिक और निकोटिनिक दोनों को एक्ट करेगा. वी कैन ऑल्सो गिव निकोटिनिक रिसेप्टर एगोनिस्ट. अंडर ट्रायल एंटीऑक्सीडेंट्स, garlic extract, curcumin, melatonin, ginkgo biloba, green tea, vitamin C, E, all the antioxidants can be given. Prevent the degeneration. Gamma secretase I have told you. 5-HT6 receptor antagonist, dimebolin. It is a 5-HT6 receptor antagonist and prevent the degeneration and apoptosis of the neurons. It is also an NMDA antagonist. Statins, I have told you. Lovastatin is used. Heavy metal chelators, I have told you, like desferrioxamine can be given because plaques are made up of heavy metals also. So, can chelate those heavy metals and prevent the degeneration. Estrogens, NSAIDs, then non-pharmacological interventions that are very important. You can add the medicines but cannot do anything with it because the disease is progressive and the damage which has been done, it's irreversible. So, increase the non-pharmacological interventions in the long run. You have to. It can be exercise, walking, cycling to improve the muscle tone. Sleep management. After a certain age, usually after 45-50 years of age, your sleep decreases. So insomnia is already there. And then you have Alzheimer also. So you will be agitated. So already insomnia, agitated. So you need sleep management. You can ask the patient कि 9 बजे के बाद घर में अंधेरा कर देना है और सोने की कोशिश करनी है. 12 बजे तक टीवी नहीं देखना. Because अगर अंधेरा करोगे तो नींद आएगी. क्यों? Melatonin, right? So, sleep management. You can also give the patient some sleep medicines if needed. Incontinence management. After a while, there will be incontinence, urinary and stools also. So we have to monitor it. A caretaker should always be there for the proper defecation and proper maturation of the patient. क्या हुआ? Then white noise. White noise is background noise. किसने सुनी है white noise? Noise तो होती है वो, but it is soothing and it works as a noise cancelling sound. You won't get some other sound, but you're getting this sound. But still it is soothing. So patient will be less agitated. Visual queen, posting pictures of bed on the bedroom. So you sleep better. Well, you can try multiple things, but mainly it relies on counseling. Counseling, and you have to relax the patient. Art of living therapy. Art of living पता है किसी को? कहाँ गया? We can also give atypical antipsychotics. For Huntington's chorea that I have explained to you, multiple CAG repeats, it is a genetic disorder, decrease in the GABAergic neurons, and GABAergic कम होंगे तो dopaminergic competitively बढ़ जाएंगे. So we have to suppress the dopamine blockers देंगे. All the antipsychotics are D2 blockers, so we can give the antipsychotics like chlorpromazine, haloperidol. Olanzapine can also be given. Tetrabenzene, it is a dopamine depleter. ठीक है? तो GABA कम हो गया, but we cannot do anything about it. तो हमने dopamine भी कम कर दिया by blocking or by depleting the dopamine. Reserpine also act by depleting all the neurotransmitters. Neuron से reserpine depletes all neurotransmitters. It releases the neurotransmitters और खत्म कर देगा. So it can also help. क्या डिस्कशन हो रहा है? Then amyotrophic lateral sclerosis. कोई मूवी देखी है इसके ऊपर? There was a famous physicist, Stephen Hawking. He was having ALS. He's very intelligent. That means brain is not affected, memory is not affected, but every other thing is affected. So you will be bound to a wheelchair, but you have a good memory. So you can still pass the exams, you can still learn things, but you are immobile. You cannot move your hands, you cannot move your legs, you are bound to a wheelchair. Only one drug is there, riluzole. It is an NMD antagonist and it is useful in ALS. But it is also terminal disease. ठीक है? तो ultimately सबसे पहले गए legs, then hands, then motor coordination will be affected and patient will die eventually because बाद में involuntary muscles भी affect होंगी और breathing will also be affected. We can also give baclofen for the spasticity. Then multiple sclerosis. It is a disease of cold climate. usually in polar regions. It is an autoimmune disease. Females में ज़्यादा होती है. Our body attacks our own nervous system. Antibodies are formed against the myelin sheath that damages the myelin sheath, or ultimately all the nerves are destroyed. ठीक है? There are few signs also. You can Google it. It's out of your topic. Lermite sign is there. You can have a electric-like sensation. वो यहाँ से आएगा और नीचे तक जाएगा electric current. That is Lermite sign. So you can have these features. You can have initially optic nerve is involved. तो you can have first of all color vision affect होगा, उसके बाद normal vision भी affect होगा. ठीक है? एनोपिया हो जाएगा, होमोनिमस एनोपिया हो जाएगा, टेम्पोरल एनोपिया होगा, ये सब होगा, विजन अफेक्ट होगा. What we give? We give beta interferon or glatiramir. It is a myelin basic protein. It resembles it. और बैक्लोफेन वगैरह स्पास्टिटी के लिए दे सकते हैं. Natalizumab. It is a monoclonal antibody for multiple sclerosis, but it has important adverse effect. That is progressive multifocal leukoencephalopathy. Progressive multifocal leukoencephalopathy. Progressive है, multiple जगह पे है. Leukoencephalopathy मतलब white matter. White matter is involved. Leuko means white. Encephalopathy affecting white matter of the brain. ठीक है? तो हमने ड्रग दी मल्टीपल स्क्लेरोसिस के लिए, but it has caused progressive multifocal leukoencephalopathy और degeneration हो गया. So it is a very risky drug to be given. So we rely on beta interferon. Clarithromycin we given. Fingolimod. It is a sphingosine 1-phosphate. ये क्या करेगा? It also causes myelination. तो अगर myelin affected हो रहा है तो it causes myelination of the neurons. Dalfampridine. It is a oral potassium channel blocker. Potassium channel opener क्या करेंगे? Hyperpolarization. तो blocker क्या करेंगे? Depolarization. तो neurons will get activate for a while. So it can be given. It improves the walking in the patients. Modafinil. Modafinil is also given for jet lag. It improves your sleep-wake cycle. So modafinil can also be given. ठीक है? This is all about neurodegenerative diseases. I've tried to make it simple and understandable. आया कुछ समझ में किसी के? ठीक है? बेसिक्स पता होने चाहिए आपको. इतना भी लिख दोगे तो बहुत एग्जाम के लिए.